And it's great to be with you all this afternoon. So first, I just want to give some caveats. I am here to provide an overview of the budget and also some key legislation pieces that passed. I'm not an expert in all of these things, and there may be some things that you know that happened that I have missed. So I hope that you will certainly engage with me around this presentation and let me know if there are things you think I should add to this. Um, let's see if I can move my screen. Okay, so here's a quick overview of my presentation today and how we're going to spend our time. I want to give you this up front so you're not thinking, well, what about that bill that passed? I really am going to start with the budget. I'm going to give you sort of a quick timeline of how the budget process works, then talk about different pieces that I have organized into different categories in terms of how they impact nonprofits. The first is sort of things that impact organizations themselves. Some of those are fairly broad, so uh, you may disagree with my characterization, but that's how I've tried to organize it. And then things that are not specific to nonprofits, but may impact either your staff or your clients. And then I also have a list of things that I found in the budget, which were direct allocations for nonprofit organizations. Then I'll talk about some other big budget items that I think are important for all of us who live here in Rhode Island and work in Rhode Island to know. Some big things that were sort of talked about a lot this session that were not included, and then do several slides with some bills that did pass that became law that were not part of the budget process, but also impact Rhode Island nonprofits. And then hopefully we'll have some time to share other things that I've forgotten or things that you think are important to share with each other. I am happy for you to ask questions as we go. I will also be sharing the slides after as a PDF, so you will have all of the information here because there are a lot of words on these slides. So forgive me for that in advance, but I figured more is better with a lot of these things. So if you do have a question, you can put it in the chat and Robin will interrupt me and ask it because I will try to see them, but I may not be able to pull that off. Okay, so just as a quick overview for folks who aren't intimately engaged in how the budget process works, the way that works here in Rhode Island is different in every state. So if you took civics someplace else, this is a completely different process. The governor introduces his version of a proposed FY26 budget in January. So that was introduced the third week of January, and then it becomes a bill. So it's House Bill 5076. The budget is for state fiscal year 26, which means it started July 1st, so just a couple weeks ago, and it runs through June 30th of 2026. It's always called the fiscal year for the year it's ending. After it's introduced, the House and Senate Finance Committees both had lots of hearings on the governor's proposals. Then a thing that happens every year in May, it also happens in November, where all of the fiscal teams, so the House fiscal team, the Senate fiscal team, the governor's fiscal team, and then the Department of Revenue get together and look at how revenues are coming in. So how many taxes are coming in, how much they think lottery earnings will be. And then also they look at caseloads for the entitlement programs. So anything that we have to fund, so Rhode Island Works, child care assistance, Medicaid, mostly, those things, they look at what the caseloads are for those programs so we know how much we have to spend. So they always do that in May. They do it again in November. But the May one really shows us sort of how much money the General Assembly has to actually spend. They learned this May that they had 61 million extra dollars than they expected, which was good news, especially in a year where we're facing some uncertainty around federal funds. Then the House Finance Committee introduced and approved their version of the final bill on June 10th. That is, it's pretty much done by the time the House Finance Committee introduces it. They introduce it and approve it all in one night. It takes a couple hours for them to go through it, but there's not really time for anyone to weigh in or provide any feedback. Then it has to sit for a week. So the full House voted on it. A week later, there were some very minor changes that happened during that week, but pretty much what was introduced to the House Finance Committee is what passed. Then the Senate Finance Committee voted on the same version the next day, and then the full Senate passed it on June 20th. We did have a bit of a unusual thing happen this year, which seems to be purely political. The governor refused to sign the budget, but it still becomes effective without his signature, even if he doesn't sign it. His other option was to veto it, but he would then, the General Assembly would have the 2/3 vote to override his veto. So this was really just sort of a statement of his that he was unhappy with some of the revenue increases that were included in it. But it did get signed into law before July 1st. So that this year has started. The final approved budget was $14.3 billion. That's an increase of $376 million from last fiscal year. And this is just a breakdown for folks so you can see that, 36% of our whole budget is federal funds. So when we think about what's happening right now in Congress, that will impact our state budget because a significant portion of our state budget are those federal funds. Restricted receipts are things that are brought in. So like, for instance, the gas tax, and then it's assigned directly to something specific. So the gas tax is going to help fund RIPTA this year. So that's that category. And then other funds are things like lottery. So we collect them, but then we have to give them out in winnings, and some other sort of things like that. They're different than restricted receipts, but are for specific categories of things. So just a reminder that the budget does two things. It allocates money for the state to spend in the next fiscal year, and it also makes actual policy and law changes. The law changes are in the budget article. So if you go to the General Assembly's website, on the bottom left, there's a button that says budget documents. And it brings you to this page, and you can read all of the budget articles. Article 1 is the article that has all of the funding allocations. This is hard to read, so I recommend that you actually do the House or Senate fiscal staff summaries, and I'll show you how to get to those at the end. But just people, I think, sometimes think that they are just doing financial things in the budget, but they are making policy changes as well. So this is how I'm going to organize my presentation today. As I said, things that directly impact nonprofit sector, things that help our clients or employees, and then a list of direct allocations. So just to get started, let's see. So I've tried to organize these in categories. So this is on the health front. So these are things, again, that were in the budget that impact some nonprofits. So the primary care rate reimbursements, I'm sure everybody heard a lot about this year, 8.3 million from general revenue. And then a significant more of federal funds are going to increase Medicaid primary rate reimbursements so that they match the Medicare rates, and those start October 1st. So they haven't started yet. There was also $12 million to help hire new staff at nursing home facilities. They had new staff requirements that they have not been meeting. And so this $12 million is intended to help ensure that they can hire the staff to meet the requirements. There was also a new revenue generator with a new fee on hospital insurance plans. It's about $4 a month per insured person that would help fund the primary care rate. It would generate about $30 million. Then the federally qualified health centers received an extra $10.5 million. 4 of that was general revenue funds to help increase reimbursements for federally qualified health centers. Home care rates, which are home care in this context is for seniors getting care in their homes, so that they're not in nursing homes. There was 125.7 million in general revenue, and then about double that of, or the same amount of that in federal funds for fee-for-service home and community-based programs. On the housing front, there were 4 new revenue streams that were included in the budget to support housing: an increased real estate conveyance tax, a local hotel tax, a whole home short-term rental tax, and then a non-owner occupied tax. The idea with this is that this would bring in a significant amount of money to help fund housing and homelessness investments, including an extra $4 million for the homelessness fund. And as I said, I'll include these slides for you so you can, you don't have to write down all the details. And then on the investment side, the budget included $2.5 million from general revenue to the Housing Resource and Homelessness Restricted Receipts account as a one-time bridge. It also carried over $4 million from FY25. And as you may have heard, there were a number of changes. Again, these are policy changes in terms of organizing the housing governance structure. So it eliminated the State Housing Resources Commission. It made the Secretary of Housing the statutory chair of the Rhode Island Housing Board of Commissioners, established the Department of Housing as an executive office of housing, created an advisory council on housing and homelessness to advise the executive office, transfers oversight of the Housing Production Fund from Rhode Island Housing to the executive office, and amended the structure of the Interagency Council on Homelessness, and established the Interagency Council on Housing Production and Preservation, both to be advised by the Council on Housing and Homelessness. So as you may remember, they created the Office of Housing a couple years ago, but there have been lots of discussions about how all the different pieces now fit together. So this is the new plan to organize that in a more cohesive way. And again, this was in the budget articles of the budget. So then, and I will talk about some of the housing bills that passed later when we get to the bills. So investments and changes around child welfare in either the DCYF budget, EOHHS, or BHDDH. They did put in funding for the Mobile Response and Stabilization, which is a program that it was a pilot originally paid for by feds, and they are going to try to continue it. They are putting in extra funding for the 988 hotline, which is sort of the mental health crisis hotline. So I think lots of people think that's a very good idea. They did increase funding for the certified community behavioral health clinics, which just started in October. So this will allow them to be funded for a full year. One thing that folks have been working on a long time is that we do have an homestead plan, but there was no funding around it. So they finally have put in some funding to start executing on the homestead plan, which is around supporting folks with disabilities to live in their homes or to live in the community as much as possible. And then DCYF funding was pretty much flat funded. There were lots of investments in it last year, but this year it was flat funded. There was some savings for congregate care to try to reduce out-of-state placements, which I think most people think is a good thing. And then some other categories, the childcare rates, which impact providers, increased 20% for infant care. Actually split the rates from, currently it has been one rate for infant and toddlers together. They split the infant separate from the toddler, and they increased the rate for infants to 20%, which is important because it's very hard to find infant care right now because you have to lower ratios, and it's hard to hire and maintain staff. So that was an important change that paid for by federal funds. Libraries were also supported in this budget, $12 million to fund their to both support public libraries and their reimbursement of expenditures. Um, there was also 2.1 million to fund library construction, the flag later around the Right to Read Act. So also it felt like it was, I don't know, I haven't asked anybody in the library world, but it feels like it was a good positive year for libraries at the state level. Unfortunately, the state did not fund the health equity zones in this year's budget. They'd funded them at 900,000 last year to support the 15 heads around the state. That was not included in this budget, and legislation um, to put them into state statute did not pass. I think they are able to continue for a while because there's some grant funding, but that was really disappointing, I know. Okay, so that's sort of the categories for big things that help nonprofit organizations. Um, for changes that help nonprofit employees or clients, I'll start with the childcare. This is for individuals who are childcare providers. There's been a pilot for a couple years that if you work in a childcare center, you can get childcare assistance to support your child as a way of encouraging people to be and stay as childcare providers. So that was continued for 3 more years. And then the PD Moms PRN is a psychiatric resource for doctors to be able to call when they're working with a mom or a baby or a child. So that pediatricians, it's mostly pediatricians, can call and work with a psychiatric consultant, which has been ongoing. That again, I think it was a pilot, and so the idea was to try to get some sustained state funds for it. On the health insurance front, they were advocates were successful in expanding eligibility for Medicare Savings Program. So there was $7 million in that to increase eligibility to 125% for the qualified Medicare beneficiary group and 168% for the qualified individuals group. So that was a big win. They also included in the budget establishing a 3-year pilot to prohibit insurers from requiring prior authorization for services ordered by primary care providers, as well as for network out-of-patient behavioral health services. On the education front, for K through 12, the school funding formula included $59 million more than last year. These are just a couple of the things that went towards that 59 million. They included 17 million for extra funding for preschool special ed, or just special ed in general. We know that there are extra costs for kids who have those needs, and the funding formula has not been good about supporting them. They also included extra funding so that the non-public school transportation and the regional district transportation could be fully functional. And then there's increased funding for school construction aid. For pre-K, you know, there's been lots of expansion in pre-K over the years. This year is actually reduced by $1 million. I think it was not that they are closing classrooms or reducing slots. It's actually kind of a math move. But I think the point is that there's been no ongoing pre-K expansion this year. There was $7.2 million to support Central Falls building a new high school. And there also is funding to help. They're going to phase out Central Falls being what's it called? Not overlooked, but being controlled by the state. And so there's some cost shifting going there as they start to have them be more independent. The Governor's Learn 365 initiative actually had a reduction in funding. It looks like there was some unspent funding from last year. So I'm not sure whether this means there will be cuts to that program or whether it's just it wasn't all spent last year. but there was not new extra funding included for this year. And then on the higher education front, there was $12.7 million for public higher education. So URI, RIC, and CCRI. There was funding for the Hope Scholarship and the Last Dollar Scholarship. There was also money for the Rhode Island Promise, but it was reduced by $1 million based on need, is what the summary says. And then the Wavemaker program, which helps professionals get their higher level degrees that they need to work in whichever profession it is, continues funding. So there are 265 new folks who will be covered for that. It's a workforce development strategy. Okay, so let me pause there and see, are there any questions? Okay, I don't see any in the chat, so just keep going. So now I have 3 pages of allocations to individual nonprofits. I tried to fit them on one page, but it was too tiny. So I just wanted to give you a sense. There are 29 nonprofits. They're sort of in different agency buckets, so they're not all listed in one place, but these are the ones that I have found. I may have missed a couple. They're in alphabetical order. A couple new ones. Gloria Jama Breast Cancer Research Foundation is new. There was Meals on Wheels had a $30,000 increase. The Rhode Island Community Food Bank had 150,000 more than last year. And then Sojourner House is a new allocation. And the Substance Use and Mental Health Leadership Council was 150. I would note that the Rhode Island State Council on the Arts, they actually were pretty much flat funded at, I think it's 1.9 million. But they did receive this 800,000, which is for grants that they can allocate out to other folks. So again, those are just the 3 pages. I always think it's kind of interesting which groups get an actual allocation. As one legislator said to me, this is a terrible way to support nonprofits. And I said, yes, but it is the reality of which we are living. So until some strong leader says we're not doing this anymore, this is how it's working. A couple other budget items that weren't exactly tied to nonprofits, but I thought were worth noting. The Washington Bridge needed another 22 million, so that was included. RIPTA was a big campaign that a lot of folks were working on. They asked for 30 million, they got 15. And that was, they had 2 revenue streams to support that. So 9 million is from the 2-cent gas tax that's already gone into account. My daughter's boyfriend's already complained to me about it. And then 6 million from the highway maintenance fund, which got them to 15 million. The state also is committed to preserving the Ride Anywhere paratransit program, but RIPTA still is facing a $17 million budget gap and says they'll have to cut services. Things that were not included, these were mostly bills, but were things that people thought might make it into the budget. The bottle bill did not pass. Health equity zones, as I mentioned, were not included. Out of school time is a push that I know the United Way has worked on a long time. $4 million was not included. The revenue for Rhode Island campaign, which would raise taxes on those making over, I think it's 680,000 a year. So the top 1% was not passed. School meals for all, which is school meal lunches for public schools, was not included. Support for bilingual educators was not included, and the Victim Act, which was $30 million for organizations that support victim services, were not included in the budget. And then here I have, I think, 3 or 4 slides around the bills that became law. So I think Melissa may be on that, so you could explain 340B probably better than I can. But basically, this says that basically the way the system works is that largely community hospitals and qualified healthcare providers and other clinics can receive a reduced cost for certain prescriptions, and then they can use the savings to fund other programs. There was folks who were trying to say that they couldn't use those savings and just reduce them out and didn't give them the savings. So this bill prohibits them from doing that so that they can continue to receive those savings and use them for the things that they use them for, including staff. Melissa, feel free to pipe in if I've done a terrible job of that. The
You did
assault
a great
weapons
job,
ban.
Rachel. Thanks. Yeah, it's about
Thanks.
rebates go back. Those savings go back into the healthcare programs and for community health centers, which are considered part, they're a covered entity in this program that allows them, and they're required in statute to provide those rebate dollars back into their programs and services at community health centers. Thanks.
Yes. Sure. And congratulations. That was, I know, something you worked really hard on this year. The assault weapons ban, what passed, it does not sort of the original bill, which would have made it illegal to sell or own an assault weapons. Now it is illegal to sell, but not a crime to own them. Baby bonds, which is something the treasurer was pushing. It's not funded, but creates a framework so if they can find funding from other sources, or maybe they find funding in the future, where every child who's born on the Rhode Island Works TNF program receives a $3,000 investment. And then when the child turns 12, they would have access to $12,000 they could invest in school or housing or whatever they wanted to use it on. The casino smoking ban is another thing that's been talked about for a long time. It passed, but it will not go into effect until January of 2027. So 18 months from now. The freedom to read protects librarians from lawsuits and creates a model policy for library curation and challenges. So this is in reaction to folks banning books. So I think I saw a lot of people at the State House on this year. So that's a great win. And then Housing and Conservation Trust Fund Act. There used to be a Housing and Conservation Board that worked to both develop housing and protect open spaces. I think it had sort of gone dormant, and so this revives it for that. I feel like I am lacking in the other areas around environmental bills this year. So if there are other things that people know about that I've left out, please flag them. Another housing piece prohibited landlords from asking a tenant about it says legislative status, their immigration status. This is already a federal law, but it was made into a state law, which is helpful, I think, in these times of increased fear. I highlighted these two because these are direct things that impact nonprofits. The first one is something I know that the Alliance worked hard on. So it increases the threshold requirement for financial audits up to $1 million. So if your budget is $1 million or less, you do not have to do an audit, which I know from experience can be quite a costly endeavor. So this is a good win. And one that I know the Alliance was definitely not working on was this next one, which is around salary disclosures as a condition of state grants. This seems to have been a pet project of Representative Serpa. Now, if you receive more than $50,000, so that list of nonprofits, of 29 nonprofits who receive funding, any of them who receive over 50,000 have to include a report to the General Assembly that lists their 5 highest compensated employees over 100,000. So I haven't seen, how that's going to work in practice, but that is the new law. And I know it's on the 990, so a lot of people think silly, but that's what it is. Um, there was a law that capped medical debt at 4% and prohibits debt resulting in liens being placed on someone's house. So I think that's probably a positive change. This snuck up on me, minimum wage increase. Minimum wage will be $16 as of January 2026 and 17 in January 2027. That will impact nonprofits because I know a lot of folks pay around that for some of their staff. Paid leave. This is increases the wage replacement rate. It's currently around, I think it's around 60%, 65% of you get back when you're out on leave. So it would increase it, I think, to 70 to start and then 75 by 2028. It also expands the amount of wages that are taxed to help pay for that. And then it expands the definition of eligible caregivers to include siblings. I know this is something the AARP worked on because we know that often folks are taking care of their elderly brother or sister and need to be able to take leave to do that. Payday lending, this was something that I worked on 15 years ago, that has finally passed. It ends the exception that that payday lenders do not have to adhere to the usury laws, which say that you can only have a 36% interest rate. Payday lenders often cumulatively end up charging about 260% interest rates. And so this was a big win for folks who have been working on this. And then there is a new law that establishes the assessed value of owner occupied low and moderate income housing as the most recent sales price of the property. This is just, I think it's just help people have some clarity around what it is, what your tax price would be, so that you can plan for any future increases that would happen. Transparency, really. And then I just wanted to mention Shakarchi's housing bills package. He introduced 12. He was able to get 10 of them through. I'm not going to go into detail with these, but there's sort of a mix of things that are trying to make things run smoother, and also allow for more building. So that's the first 5. This is the second 5, trying to help with some zoning issues that we found in local places, allow for a single family dwelling, trying to get at some of the things that happen in more rural areas, where if you were going to be able to be zoned for a vertical tenant of 2 or 3 family structure, you could also do it horizontally. And then allowing for some co-housing arrangements. So just trying to get at helping increase the amount of affordable housing and mid-range housing, and also build more housing. So that is my whole summary. And then I'm going to turn this off and hopefully hear from all of you, or I'm happy to answer questions. I just would flag, this is the General Assembly's website. The budget information is here for the list. The House fiscal pages, like I said, House and then Senate have summaries. Look for the most final summary that you can. The Senate, I think, summarizes what passed the House. I think what was introduced in the House Finance, and that is true for the House also. No, the House actually did do a summary of the budget as enacted. So a couple things aren't included in there, but generally it's pretty thorough, and you can download those and do key find searches too, which is a helpful way to find things if you need them. Okay, so what did I leave out? Please feel free to come off your mute and ask any questions or tell me what I left out. And then here's my email too if you have any questions.
I have a question, if you don't mind.
Sure.
And thank you for the presentation. I'm wondering if you have any information that you can share with us in terms of knowing the federal funding budget and where that's heading and what that impact is, that 36% impact is going to be in Rhode Island specifically. So any information you have on that can help us understand further what the state budget impact is going to be as it relates to some of the nonprofits here.
Yes. So I do not have great things to share on that today. I will say that that there are a couple pieces, right? So the big beautiful bill or the bill that just passed did include some pretty significant SNAP changes and Medicaid changes. I know for the SNAP changes that the changes to work requirements go into effect pretty quickly for individuals, but the funding changes for the state are pushed out for 2 years. So they shouldn't impact this fiscal year, but it will be something that the legislature is very much looking at for next fiscal year. So for SNAP, for instance, the requirements are it's going from a cost shift where the feds were paying 75% of admin costs to feds are going to pay 25% of admin costs. And then we will have to pay a larger percentage for benefits for SNAP because we have our error rate. If you have an error rate over 6% and we have an error rate over 12%. For the Medicaid pieces, they, again, some of the eligibility requirement changes will go into effect quicker. But the funding pieces are not immediate. So I think the good news about that is that we will have time to hear about them in next year's budget cycle, and should have the opportunity to weigh in about any changes they're going to make to eligibility levels for people before they go into effect. Does anybody else have better information they want to share? That's a very good question that I should have been more prepared for.
Just that's really helpful to know in terms of the timing of all that, because I think there's a lot of people wondering, like, is that gonna? I thought I had heard that the legislature might go back into session in the fall and sort of try to start reworking things based on this budget, but it sounds like it would more be part of next year's process then.
Yes, that is what I understand. I agree with you. There was lots of rumors that they were going to come back in, but then it looked like they pushed most of the federal changes to after the midterm elections. So that means that we have longer to figure out how to change them on state level.
Sorry for joining late because I had a conflict, but the General Assembly has also requested a report on the impact of the cuts, the bill as a whole, that it's due October 31st. So to the General Assembly. So that would also mean that if they did come back, presumably they would want that report first. And so that would push it kind of late to be coming back, but they could still, I guess, do that. But that report isn't due until October 31st. So.
What else did I miss? I know I missed things. Are there any arts people or environmental folks who have things that I didn't get?
I'll just pipe in with a couple of bills that we worked on as an alliance that impact nonprofits, which you may have covered, but just in case, I'll re-up them. One is that we had a bill to increase the audit threshold for nonprofits. Did you already cover this, Rachel?
Yes, I did get that one.
So that one is increased. There was a bill about revealing your salaries. Did you do that one too? The disclosure bill,
Yes.
which we were able to work with the sponsor to make it a neutral bill. It was not a good bill to start with, and we were able to work with them to make it a neutral bill that focused on publicly available data already, instead of asking for like how much your intern makes, which wouldn't be really helpful. The third bill that we worked on was related to the information you need to give a new employee that starts with you. Did you talk about that one, Rachel? So there's now a list of information that you need to give in the paper format to new employees about how they are paid, how they're going to be paid, like biweekly, weekly, information about basic information about the organization. It's designed to give clarity to new employees about their wages. And it was initially, because it didn't have information about what the penalty was for not providing this information, it could result in jail time. And we worked with the sponsor because we said there's lots of small nonprofits that they may not be aware of this. We don't want them to face jail time for something that they didn't know about. And so we were able to work with them. So now it's a $400 fine for the first 2 infractions, and after that it could be jail time. So the bill itself is a fine, helpful bill, but because of how it didn't include information about the penalties, it could have been really difficult for small nonprofits who might not be aware of it. So we are going to be having a session together with John Williamson from DLT to talk about compliance things that you need to know, both these kinds of new bills as well as existing regulations from the Department of Labor and Training, so that you can just make sure that you're in compliance with what is necessary in working with your HR and your employees. So that's just a small thing, but it just shows that having awareness of these bills and being able to work with the sponsors can really help improve bills that are passed, even good bills, like the wage information is a good bill by itself, but we needed to work with the sponsor in order to address those concerns. So we will be letting you know about the session with Department of Labor and Training about giving you the information that you need about that bill and other things that are important that you're complying with just as an employer. I don't have the bill number with me, but I can look it up.
And then are there other things that people are thinking about for next session that they want to share? Other things they are hopeful will come back and work on again? It feels like it's going to be an even harder budget year than this year, but there is that list of things, that folks were working really hard on that didn't pass this year. So I'm interested to hear. Melissa?
Rachel, I just had one question on the HESs. So in the prior year, given the budget cuts to HESs, and I would say, what's that, 2024, the Department of Health did provide some additional funding for them. And are you aware if they're going to kind of do the same thing again, or are the cuts and they're just sort of living on their grant dollars right now?
Nancy, do you have a better answer than I do?
They are going to be, according to Chris Ashura, they are right now living on the grant dollars and are going to be applying for some other grants. They are also going to be seeing if they can incorporate some support for the activities that HESs do across departments. So it wouldn't be specifically Department of Health. It's always a challenge to get into a department budget. And so getting into multiple department budgets is a challenge, but that is what they are planning on. So
Thanks.
it would be Department of Health as well as some other departments.
Great, thank you.
And then Nancy, do you see Cora's comment in the chat about struggles to find auditors?
Yes, so that is one of the reasons that we were able to pass the audit threshold bill, is because the Rhode Island Society of CPAs recognizes that it's just that there aren't enough auditors in the state. And so they came out in support of the bill because they get calls from nonprofits needing audit support, and they haven't been able to get referrals for them all. So that is one of the goals of increasing the audit threshold, is to make those auditors available for the folks who, a smaller group of nonprofits. So hopefully that will help alleviate some of the strain on finding an auditor. And I know that it was really difficult for all of you to find auditors on an ongoing basis, but that is one of the reasons that we were able to successfully pass the threshold bill, so that would eliminate the demand from those mid-sized nonprofits on auditors. Rachel, if you haven't, do you want to talk about the coaching cohort?
Sure. So Robin mentioned it at the beginning, but I think it starts next month, running a cohort for nonprofit individuals who work for a nonprofit who already have something that they want to work on. So we won't help you workshop an idea to begin, but if you already have an issue that you want to work on, but you're not quite sure how to get started, not sure how to find sponsors or draft legislation or write up your issue into fact sheets or create coalition or do media around it. It's a 4-week cohort. So it's a 4-session cohort. So we meet once a month for 4 months and cover those topics. I think it's limited to 12 people. So it's a small group. Last year we had, I think Melissa was in it and maybe somebody else in here. I don't know. And last year we had HES in it as well. And so this year I think we're going to have a HES one and everybody else one. So I think it's a good way to sort of both work with each other to think through strategies, and then also I try to help demystify how the process works for folks. I think it can be overwhelming, especially if you don't have policy staff in your organization who can devote your time to this, so we can think through, how to move something forward without having a full-time or even part-time person whose job it is to do that.
So the applications are open now for that. And so I don't know if Robin already shared the link, but she can share the link and also include it in the follow-up to this. And you don't have to have policy in your title to participate in it.
No.
It's just basically if you have a policy related or legislative idea, or even just a budget request, that could also be something that you can work on. Recognizing again that the budget is a challenging lift at this point, but you can certainly work on it.
Yes. Great. It looks like folks are starting to drop off, but we will share the slides with all of my many details afterwards, so folks can have them at their fingertips. And are there any last minute questions?
Thank you, everyone.